Good morning, everyone. This morning, my purpose is to be the master of ceremonies, so I'm going to be brief because we're here to listen to some very special guests. Of course, our very distinguished Secretary of Health and Human Services, Kathleen Sibelius, to our, as I say, our bosses, our constituents, Callis Loow, Leech, Meredith Shevitz, and we are here in front of the flags as we go into the 4th of July to celebrate health independence. As you know, Social Security, Medicare have been pillars of stability in our society, and now Social Security, Medicare, and health independence. That's the third pillar, something that we were very, very proud to be about. Our founders, as we observe the 4th of July, our founders talked about the Declaration of Independence guaranteeing life, liberty, and the pursuit of happiness. That is what this is all about. A healthier life, the liberty to pursue your happiness, not being job locked. You can be a cameraman, a writer. You can be self-employed, start your own business, change jobs. You are free to do all of that. That's very good for society and very good for our economy. Others will talk about what has already happened. I'm eager for us to move forward. And we are choosing today because it's about 100 days until the implementation of the Affordable Care Act. The enrollment begins October 1st, 100 days, and it is 1 year this week since the Supreme Court upheld the constitutionality of the Affordable Care Act. So we have a lot to celebrate, and that's why we're proud to stand before the flags to celebrate life, liberty, and the pursuit of happiness, and to pay tribute to the Secretary and the President for their leadership in making that freedom possible for the people of our country. Secretary Sebelius is a great secretary. Her implementation of this is fabulous. She was the governor of Kansas. She was the insurance commissioner. She knows of what she speaks. She knows it in detail. More important than that, she has a vision for America that has health care as a right for every person, not just a privilege for the few. In that spirit, I'm pleased to introduce the distinguished Secretary of Health and Human Services, Kathleen Sebelius.
Thank you. Well, thank you very much, Leader Pelosi. And I think it goes without saying that not only the leader, but the rest of the House leadership and the members who are here, there wouldn't be a celebration today without the hard work of the folks in this room who actually made sure that the Affordable Care Act was passed and signed into law by the President in March of 2010. So thank you, thank you, thank you. For the 85% of Americans who already have insurance, either through their employer or through a program like Medicare, the Affordable Care Act is, as the leader said, already making a difference. Over the last 3 years, tens of millions of families have been freed from the fear of hitting a lifetime limit or having their coverage canceled because of a paperwork error. Millions of seniors are saving an average of more than $600 a year, $600 a year on their prescription drugs. And millions of young Americans are keeping their coverage as they start their careers or pursue graduate school. If you have health coverage, that coverage is more secure today because of the Affordable Care Act. But the health law also carried the promise of providing better coverage options for those Americans who found themselves locked out or priced out or dumped out of the insurance market. We had a market that worked pretty well for insurance companies, but not so well for a lot of families and small business owners. So in less than 100 days, on October 1st, that promise will be fulfilled when new health insurance marketplaces open for business in every state in the country. The markets will give Americans a better way to shop for health insurance. For the first time ever in history, consumers can go to one stop, make apples-to-apples comparison of prices and benefits, and companies, for the first time ever, will have to compete for their customers on price and service, not in who does the best job of medically underwriting and dumping people out of a plan. Every insurance plan has to cover a comprehensive set of benefits, including physician visits, hospital stays, prescriptions, and people with a health condition won't be turned away ever again. That discrimination is over. No more pre-existing conditions. And being a woman is no longer a pre-existing condition. Gender discrimination is over. So for millions of families and small businesses, they also look forward to a break on their monthly premiums. And what that means, simply, is no matter where you live or what your situation is, affordable health coverage will be within reach. We recognize this is a huge undertaking. If it was easy, it would have been done decades ago. But we are on track, finally, to get it done. And I want to be clear, we are ready to go on October 1st. So this week, we had another big step forward when we launched our 2 new and improved websites, healthcare.gov, the English version, and Cuidado de Salud, the Spanish version. Online homes of the marketplace, and they're up and running. We also opened a toll-free 24-hour call center that's going to operate 7 days a week. We have translators who can give advice in 150 languages so people can call and get information. We have web chats possible. We have live folks available. The new tools are part of a series of steps we're taking to make sure that Americans can take advantage of the improved health coverage options. We'll be unveiling new partnerships, holding events around the country, and funding outreach efforts through community health centers and other local organizations. So we've got a lot of work to do in the next 100 days, but every day we get reminders of how important the goal is that we're working toward. Early reports have already shown that the marketplace is going to give a lot of consumers choices that they've never had before. And we've seen very promising news about rates offered in states from Rhode Island all the way to California, blowing away the myth that somehow we're going to see rates skyrocket. So more choice and better rates. In the coming months, we are going to be reaching out to uninsured Americans and underinsured Americans to let them know what's coming. A health insurance market that works for you is finally on its way, and the days of insurance company underwriting is coming to an end. So we're going to let all Americans know that changing jobs or retiring early or pursuing a dream or starting a small business is now much more possible because health security and, as the leader said, health independence is coming. And I want to thank our guests, Callis and Annie and Meredith, who have some real-life examples to share about what has already happened to them thanks to this new Affordable Care Act. And thank you for letting me be with you today.
Thank you, Madam Secretary.
Madam Secretary, thank you very much. To talk further about independence, I'm a graduate of Suitland High School. That's interesting. But we have somebody from Suitland, Maryland, where I went to high school, here to speak to us about what it's going to do for her and her neighbors and friends and family. Annie Leech. Annie? Yes. Thank you. Come on up.
Thank you. Good morning.
Good morning.
My name is Annie Leech. I am 67 years old. I am a retired cook. Among many jobs that I've held today on behalf of the Alliance for Retirement Americans. I live in Suitland, Maryland. I have a beneficiary personal farm, health care farm. Thanks to the Affordable Care Act, seniors began receiving a free annual checkup in 2011, and the beneficiaries no longer have to pay any cost or share for preventive service. The law of coverage, coronary cancer screening test. As a Medicare beneficiary, I was able to take advantage of the annual wellness checkup in March of last year. At first, my doctor did not know the service was for paid. Then someone close to me informed him that he was in error and attempted to charge me. We were right, and I did not have to pay. The Affordable Care Act work the way it was designed.
Wonderful.
It is important for my peace of mind to know that these protections to my health are placed in peace. Looking forward, I know that I've done all I can to keep my medical care costs down. Thank you for giving me the opportunity to speak for many seniors today. Thank you.
That was
We're going to ask Annie to run for Congress.
Be careful.
Sandy, she's from Maryland, not from California. Esperanza. That means hope. That's a necessary ingredient if you want to have life, liberty, and the pursuit of happiness. And this health security law that's now in place offers hope. But there's no one who could talk about hope better than a cancer survivor. So let me now introduce to you Callis Loow.
Thank you very much. Good morning, everyone.
Good morning.
My name is Callis Loow, and I would first like to thank Leader Pelosi for the opportunity to share my story today. Thank you, President Obama, for making the success of the Affordable Care Act a high priority. And thank you, Secretary Sebelius, for all your dedicated work in implementing the law and making sure that things are done correctly the first time around. As a former student body president, I worked on building public support for the Affordable Care Act through the U.S. Student Association, and I never would have imagined the impact it would have on my life. We worked on the Affordable Care Act because House leaders included the Student Aid and Fiscal Responsibility Act, which cut profits to banks and provided more student aid to make college more affordable. In June 2011, I graduated from the University of California, Santa Cruz, which led to the termination of my university health insurance. My parents maintained a working-class household and did not have insurance themselves, so I purchased short-term health insurance just to be safe. Shortly after having gone through weeks of medical testing, I was diagnosed with stage 3 Hodgkin's disease. Because my cancer was in its late stages, it was deemed a pre-existing condition, although I initially had no prior knowledge of my illness. My insurance company notified my doctor and I that anything relating to my illness would not be covered by my plan. My family struggled to pull money together to meet my deductible, get through all my required medical tests, and start chemotherapy. One of the tests I had was a full-body CT scan that cost $2,300 just for the procedure. To process the results, a bill in the mail came for $10,000. I tried working with my health insurance company, but that produced no results. It just so happened that one day in February 2012, after House Republicans repeated a repeal on the Affordable Care Act, Leader Pelosi appeared before television to talk about the Affordable Care Act and how it works. She said that the health law was already helping millions of Americans across the country. Because of Leader Pelosi, I learned that as a result of the Affordable Care Act, California contracted with the Department of Health and Human Services to establish a federally funded high-risk pool to provide coverage for medically uninsurable individuals who live in California. After going months without health insurance, I qualified and received health care that my family could afford. It also prevented approximately $25,000 of medical bills from being added to my current debt. Today, I get to live and I get to take back my life into my own hands. Although they didn't know my story or what my story will eventually be, Leader Pelosi, members of Congress, and President Obama fought for me, fought for the American public. They made a promise guaranteeing that every American will have access to affordable and quality health care. And for me, they made good on that promise.
Good.
Thank you very much.
Thank you very much, Secretary Sebelius. Thank you, Leader Pelosi, and thank you to the members of this Congress. I often say that no matter who we may think we are or what we may think we are, we can be no more nor can we be any less than what our experiences allow us to be. And I think that what you hear today are the experiences of people who have benefited from the Affordable Care Act. And to further that discussion, I'm pleased to present now Meredith Shevitz, who is a student at New York, NYC, or who is from New York, who suffers from diabetes. And as one who lives with a wife who has one time been a full shot a day diabetic, I know what that disease is all about. Meredith?
Good morning, everyone.
Morning.
Thank you, Leader Pelosi, Secretary Sibelius, and members of Congress for being here this morning. My name is Meredith Shevitz, and I'm a student at New York University. I was diagnosed with type 1 diabetes in the second week of my senior year of high school almost 4 years ago. During my hospital stay, I learned just how much my daily life was going to change from that day forward. Type 1 diabetes is a chronic, pre-existing condition that requires checking my blood sugar, monitoring my food intake, and insulin injections several times each day, as well as multiple appointments each year with endocrinologists, nutritionists, and several other specialists. There currently is no cure for type 1 diabetes, so this form of treatment is the only method to control the effects of the disease. Without insurance, it is nearly impossible to pay out of pocket for insulin and testing supplies necessary to stay alive and lead a nearly normal life. The Affordable Care Act meets these essential needs in several ways. It allows me to stay on my parents' health insurance plan until I'm 26 years old, so I don't need to rely on my university's insurance plan during my early 20s. And starting in just 5 months, the law will prohibit insurance companies from denying my coverage based on this pre-existing condition that requires so much medical attention. Surprisingly, about 16% of young adults in my age bracket have some form of a pre-existing condition like I do. The law also creates insurance exchanges, which guarantee access to coverage I need to enjoy a healthy and productive life, no matter where I work or where my career takes me. Those exchanges open in less than 100 days. When people with type 1 diabetes don't have insurance and therefore can't afford the proper medications and technology to properly control their condition, the results can be devastating. Nobody should be denied the ability to lead a healthy life. I remember feeling overjoyed when the Affordable Care Act passed in 2010. So on this anniversary of the Supreme Court decision, I want to thank Young Invincibles for helping me share my story, and most importantly, thank Congress and President Obama for passing legislation that will allow me to live my life without fear of losing my insurance coverage or my health.
What could be more eloquent than our guest here today telling their personal stories? They are joined here on the podium by many friends who helped pass the Affordable Care Act and now to implement it, whether it's students who are invincibles, whether it's the National Physicians Alliance, whether it's an American Nurses Association, the Catholic Hospital Association, individual nurses, pediatric, Dr. Haley Tisha, pediatrics instructor at Harvard Medical School. Just the list goes on and on. I thank them for joining us, all suited up for care. And in closing, I just want to say this because our guest said it so beautifully, and our secretary has led us so magnificently, as well as our President Obama, on this and other subjects. I tell this story because it is a way of thanking all of you. The morning after the affordable health care bill passed the House of Representatives, Mr. Hoyer and Mr. Clyburn and Mr. Becerra and Rosa DeLauro, my other colleagues who are here, our ranking member on the Small Business Committee, Nydia Velasquez, our vice chair of the caucus, Mr. Crowley, other members and members of the leadership, Mr. Andrews, chair of our policy committee, along with Congresswoman DeLauro. And let's see, who did I not mention of our members? Paul Tonko, Mr. Butterfield from North Carolina, Don Payne, one of our newest members of Congress from New Jersey, Robin Kelly, our second newest member of Congress, and she's from Illinois, Marcia Fudge, the chair of the Congressional Black Caucus, just so wonderful, thank you, and we have work to do to offset what the court did yesterday. Right. Sandy Levin, our ranking member on the Ways and Means Committee. Keith Ellison, co-chair of the Progressive Caucus. Are there any other members? Some have come and gone. Joe Kennedy was here. Oh, Jim Langevin of Rhode Island, a champion on this issue. And so these and others who were in here and now had to go to their committee meetings. But I thank them, and I thank our guest, and I thank all of you. Madam Secretary has heard me tell this story, as have my colleagues, but in case there's anybody in the room who hasn't heard it, I'll tell it again, as in the spirit of independence, of freedom, of life, liberty, and the pursuit of happiness. The morning after the bill passed, as I began, the president called and he said, last night when the Affordable Care Act passed the Congress, the House of Representatives, I was happier than I was the night I was elected President of the United States. And I said, Mr. President, right, Stenny, we were all very happy too last night, but we weren't happier than you were the night you were elected President. I said, because if you weren't elected President of the United States, it would not have happened. But your inspiration, your leadership, your signature, and the rest. And so it couldn't not happen without him. But I say that to all of you. It could not have happened without all of you. It took everything. So I hope it's a level of satisfaction to you as we go into the implementation, as we liberate the American people from the fear of illness and the cost associated with it, that you take personal satisfaction in the role that all of you played in order for us to pass the affordable health care to provide life, liberty, pursuit of happiness for all Americans. Thank you all very much for being with us today.